Welcome to Back Talking. I'm Todd Wegerski, and I'll be your host for the show. Now, the show today is titled The Back Pain Epidemic. And in this episode, I'm going to take about 15 minutes to discuss the current state of back pain in the United States today, with some rather startling and shocking statistics about its occurrence rates and the costs associated with dealing with back pain. And also, we'll talk about what has caused us to have the current situation that we face today. Now, if you missed episode 0, the reason for the Back Talking show is to help bridge the gap that exists between people suffering from back pain and those who have the knowledge, experience, and expertise to help. Now, the big difference between the books, websites, videos, and such out there is that you get me. Hey, I'm a real live person that you can talk to and interact with via these hangouts, webinars, and email. And hopefully I'll provide some answers that will help you along your back pain journey. So who am I? Again, I'm Todd Wegerski. I'm a doctor of chiropractic and also an acupuncturist. And I've been in private practice for the past 18 years here in Cary, North Carolina, which is a suburb of Raleigh. So I've had the privilege of helping and coaching many people over the years deal with and conquer their back or neck pain. So without further ado, I'm just going to kind of jump into the slideshow. Unfortunately, I'm going to kind of disappear for a while, but there's a lot of information that we got to get through, and we'll just jump right in. So let me start my screen share. And there you have it, episode 1, Back Pain Epidemic. All right. So now back pain, it doesn't discriminate. It affects the young, the old, women and men, athletes, couch potatoes, city dwellers, and country folk. Now, our modern lifestyle, it has many benefits. We no longer have to hitch up the wagon to go to the general store, nor do we have to plow the back 40 to help feed our family. But today, 80% of the population will experience back pain at some point in their life. But of those, 50% will have a recurrence of that problem every year. Now, it's the number 2 reason for doctor visits, second only to the common cold. Back pain causes more disability than any other single medical condition in the world, with neck pain ranking number 4. Direct costs to treat low back pain, $102 billion estimated. And when you add in indirect costs, such as disability, lost work days, lost productivity, that number approaches almost $200 billion. Now, SRDs, as you see it at the bottom there, stands for spinal-related disorders. Now, the burden of spinal-related disorders, it weighs heavily on our healthcare system, society, and industry. As we saw in the previous slide, a significant amount of time, money, and resources are spent dealing with spinal-related disorders. Again, remember, it was the number 2 reason for doctor visits. Now, low back pain, it accounts for 27 million patient visits per year. Neck pain, 10 million. And between 1999 and 2008, the cost for outpatient treatment of neck or back pain increased by 95%. So we saw almost a doubling in costs in that 10-year span. Now, most of the increased spending was associated with increased specialty visits and not on primary care evaluation. Now, with the significant increase in spending, one would expect outcomes to improve. But in fact, disability from spinal-related disorders is rising. Now, what does this mean for employers? Well, that cost needs to be passed on to someone. And for those who are employed and get their health insurance premiums, or health insurance rather, through their employers, that cost gets passed on to your employer and ultimately on to you. You get an increase in those health insurance premiums every year, and you also see an increase in disability insurance premiums. But despite spending, onto the slide here, despite spending over $100 billion a year on the treatment for back pain, Americans continue to struggle with this problem. It has become a national epidemic. It's the #1 cause of job-related disability in the United States. It accounts for 25% of all workers' comp claims. It's the second most common reason to miss work, behind #1, the common cold. And the cost of back pain to employers is about $61 billion per year. And the average workers' comp claim for back pain is $20,000. That's just the average. Now, the natural course of back pain, as recently as about 20 years ago, the long-held belief was that even if nothing was done, back pain and neck pain would run its course. It was self-limiting. And that in 6 weeks' time, hey, it's run its course, it's done, it's over. But that's been found to be not true. Current research shows that back pain significantly increases the risk of limited physical activity and function many years after onset, such as 50% of back pain patients experience persistent pain for at least 12 months following its onset. Half will have pain still 1 year. And between 50 and 75% of those who did report neck pain continue to experience the pain 1 to 5 years later. Now, we've discovered that there's lasting changes when back pain occurs. We see changes in muscle activation and control patterns. It impairs the spine's ability to protect itself. An atrophy of a specific muscle called the multifidus, which is a significant spine stabilizer. But though most recurrences aren't disabling, the emerging picture of back pain is that it's similar to a disorder such as asthma, with periods of exacerbations and remissions, and that it must be managed. On to the next slide. But what has led us to this epidemic? Well, there's many options out there, which leads to further confusion. We get advice from family, friends, coworkers, but what worked for one may not work for others. So who should you see? Should I see my massage therapist, my personal trainer, my primary care physician? Do I go to a chiropractor? How about a physical therapist? What about an orthopedist, neurologist, acupuncturist? As you can see, there's many options out there. And point number 2, what has led us to this back pain epidemic that we see today? Mismanagement at the primary care stage. Now, don't shoot the messenger. I'm just reporting the facts. Now, there's been several evidence-based guidelines have been published on the management of low back pain, and these were published over 10 years ago. However, recent studies show that providers are not implementing these guidelines appropriately, especially with regards to advanced imaging, specialist referrals, and invasive procedures. Now, treatment that is incompatible with the guidelines, it's associated with higher overall costs related to spinal-related disorders. Now, the standard general practitioner, that's what GP stands for, standard general practitioner treatment. You'll get a prescription painkiller, anti-inflammatory or an NSAID, muscle relaxer, and advice for rest. Now, all of these treatments focus on the symptoms, and there's little evidence that they have any lasting effect. Now, relief of pain has been deemed the primary objective of treatment, while often finding the true cause has been neglected. Now, this approach, where the patient plays a passive role, such as popping pills and resting, has been a failure. And the broad impact of neuromusculoskeletal conditions on society and on we've had limited success in managing back pain and neck pain warrants a new approach. Now, part of the struggle is that there's many potential causes of pain. It's multifactorial. It could be structural, it could be neurological, or it could be psychological. And there is no one-size-fits-all magic bullet for back pain sufferers. It's been deemed a low priority. Because back pain is considered a non-life-threatening disorder, it doesn't get the attention of your primary care physician as other disorders do. In one interview study, primary care physicians perceived back pain as a low clinical priority and uninteresting in comparison to the major chronic illnesses such as heart disease, diabetes, that they must manage for their patients. And in the same study, primary care physicians said that shifting this population of patients to a non-physician provider would be perceived as a positive step towards alleviating their burden of work. And also, they have no clinical confidence. Several peer-reviewed studies and published articles show that spinal-related disorders may be challenging for a primary care physician to manage appropriately. And they lacked clinical confidence in what has been termed bankrupt expertise. Now, another study, primary care physicians lack confidence in their ability to assess and supply evidence-based care for back pain, and that some expressed anxiety about not being able to help or give adequate explanations. Now, again, I'm not bashing primary care physicians, internists, family practice. They have such a broad, so many issues that they deal with. It's a mile wide, but their knowledge is an inch deep. Again, not bashing them, mile wide and an inch deep. But what we need is that back pain needs to be handled by people that, it's a narrow focus, where their focus is, an inch wide and a mile deep. Now, what has led us to this epidemic? Exercise rates in the US. 80%, 4 out of 5, of Americans do not get the recommended amounts of exercise each week, potentially setting themselves up for years of health problems. Now, the recommended guidelines are 2.5 hours per week of moderate intensity exercise, or 30 minutes a day, or 1.25 hours of vigorous intensity exercise. And also, adults should be doing some form of muscle strengthening activities 2 times per week. Now, exercise helps control weight and increases strength, our endurance, coordination, and it reduces the risk of heart disease and some cancers. The latest buzz out is, I've heard this term in a lot of places, sitting is the new smoking. 1 in 10 deaths worldwide are caused by people not getting up and engaging in some form of physical activity. Sitting increases the risk of obesity, increases risk of type 2 diabetes. And sitting is one activity that places tremendous strain on the lower back. So we go from the car to our office chair to the couch. Americans are sitting more now than ever. Now, what else has led us to this? It's our modern lifestyle. All age groups spend as much time in front of a PC, laptop, tablet, phone screen as they do asleep in bed. So think about that. We spend as much time looking at a screen as we do in bed. Greater than 55-year-olds spend on average 6.64 hours in front of a screen. 18 to 24-year-olds spend on average 8.83 hours in front of a screen. And that age group, 84% admit to suffering from back pain in the past year. And that age group loses more working days to back pain than those in their parents' generation. 1.5 days more. And their pain is more likely to be experienced in the upper back and neck. And it's most likely due to being hunched over a phone or some type of handheld device. And finally, what has led us to this is obesity. Some staggering statistics here. 35% of adults greater than 20 years old are obese. 69% of adults greater than 20 years old are overweight or obese. 69%. 18% of 12 to 19-year-olds are obese. 18% of 6 to 11-year-olds are obese. 12% of 2 to 5-year-olds are obese. Unbelievable statistics. So to recap, we have 80% of the population suffering from back pain at some point in their life. And of those, 50% have a recurrence every year. This has placed a huge burden on our medical system, as it is the number 2 reason for doctor visits. The costs associated with dealing with back pain, disability, and lost worker productivity is staggering, placing a huge burden on our society. And what has led us to this? The so-called healthcare funnel has let people down. Care is being mismanaged at the top of the funnel by physicians who don't see it as a priority, have little to offer in the way of care in an area that they're not comfortable handling. Our modern lifestyle and modern conveniences has caused our activity levels to drop. We sit more now than ever. We spend staggering amounts of time in front of screens. Before it was the television, but now you throw in cell phones, tablets, computers. We're fatter than ever. And the problem is only getting worse when you look at these childhood obesity stats. So talk to me. You see this final slide, back talk to me. Any questions, comments? I'd like to know what people are dealing with, what challenges you're facing, and how I can be of help. You can reach out to me. Future show ideas, comments, questions. Email me, todd@backtalkinghelp.com. Again, todd@backtalkinghelp.com. And you can see it there at the bottom of the screen. And I look forward to hearing from you. And I'll catch you the next time.